a pulse without respiratory rate, and unresponsive, usually showing asystole on the cardiac monitor, aka a flat line. Now, if no caregivers are around to help, you must initiate immediate CPR with high-quality chest compressions. So, key terms there, write it down. Start with chest compressions. We do this before calling for help if you are the only caregiver. So write that down. Most students get this wrong. This immediate CPR with chest compressions helps to provide immediate oxygen or perfusion to the brain and vital organs in order to prevent damage and even death. Now, on the NCLEX, you must know proper CPR and how to properly use an AED. We're going to focus on this since the NCLEX focuses on this. So for adult CPR, just remember chest compressions immediately. And the key numbers to write down is a rate between 100 to 120 compressions per minute. Huge NCLEX tip, so write that one down. A depth of at least 2 to 2.5 inches, or 5 to 6 centimeters. Another big NCLEX tip. And we put the hands in the center of the chest on the lower half of the sternum. Now, in terms of breaths, if we're giving it manual, then it's 30 compressions and 2 rescue breaths. And if the patient is intubated, then we do every 6 seconds without interruption. Now, after each compression, the chest should fully recoil and refill completely to allow the heart chambers to refill with blood in order to get as much blood out to the body with each compression. So during CPR, compressions are paused every 2 minutes to assess the pulse. The pause should not be more than 10 seconds. Remember that. So write it down. Not more than 10 seconds when checking a pulse every 2 minutes. Now, when the AED is available, the automatic external defibrillator, it should be used ASAP. Do not wait. Slap those bad boys on and defibrillate immediately. So, AED pads 8 years and older should be placed, key terms here, in the upper right of the chest, near the shoulder, and on the left lateral chest, near the axilla line below the nipple there. So don't let the NCLEX trick you here. Not in the middle of the chest, that's for children. So remember, go wide with adults, since adults are bigger. Now, when you're ready to shock, there's 3 key points, so write this down. Number 1, defibrillator pads are placed. Number 2, call out and look. The NCLEX really stress this because it's safety. We're doing this to make sure everyone is clear. Then number 3, chest compressions continue immediately right after the shock is delivered. And for defibrillation, little side note, no IV sedation is used and no synchronized button is used. This is for cardioversion, which we cover in a separate video.